Jorge Rosario, a licensed barber from New York, was insured under Medicaid until 2 years ago. But now that his income is slightly higher, he no longer qualifies.
When I needed to go to the hospital, I just go to the hospital, and I knew that I had insurance, and I wouldn't get all these bills. And now that I go to the hospital, now every time I go to the hospital, I get all these bills coming in, and they're pretty hard to pay, man, because it's not easy.
As an employee of a small business owner, Jorge does not get employer-sponsored insurance and cannot afford to buy his own.
Well, I don't make that much money, sometimes $200, $250 a week. I gotta pay rent, I gotta take care of my son. I got a car note that I gotta take care of. It's just hard, it's difficult.
Jorge doesn't only have to worry about not being able to cover his medical bills, but also about carrying with the stigma of a bad credit report.
If I get sick, if I get really sick, it's gonna mess up my credit, because if I don't pay these bills, they're gonna go into they're gonna take them to the credit, to the people that charge you for credit and stuff like that. And it's just difficult, man. It's difficult paying $200, $300, and then if you don't do it, they send it to an agency, and then the agency starts to bother you. That's one of the main reasons, That's very difficult.
Something that Jorge is trying very hard not to pass along to his son, who, although is not even of legal age to be responsible for his own bills, is already starting to pile them up.
My son is only 14 years old. I just got a bill from $125 because he's been having these chronic acne. It's like real chronic, and the medicines and everything that we was using was not good. So now he's getting charged. They sending him bills under his social security number, $125, $100 and something that he can't pay, and it's hard for me to pay. I can barely pay for what I'm barely making enough money for myself, and now to take care of his medical benefits is even harder.
So what's in store for the growing number of uninsured Americans? When is Jorge, his son, and millions more going to start seeing the light at the end of the tunnel?
Before we continue, let's see a comment from the Destination Casa Blanca blog. Maria Maldonado from New York posted, "Health IT is beneficial to both patients and caregivers. However, it should not be a priority for now since so many are uninsured. That should be a top priority. Working deep in the healthcare system and other public services to ensure that more Americans are receiving what they need and to make it more difficult for some to abuse the system." We had dropped off in the conversation. Dennis, I want to get back to you. We wanted to talk about wellness care and its role in all of this.
Well, the reality is that one of the problems that we have is that in the United States, the way that we eat, the lack of exercise, the lack of good taking care of ourselves has a lot to do. For example, Latino children, of the ones that were born in the year 2000, I just saw a study that says that half of all those children are going to have diabetes when they grow up. And the reason is because the diet. We're eating foods that are not good. So the lack of exercise, living a sedentary life. So wellness is something that it's our responsibility, and we can deal with that.
One of the things that raises is the issue of personal responsibility. That somehow, and the president referred to that in another context just the other night, that people also have, the public, citizens, have a responsibility as well on many of these issues. And I know that often goes to the core of what conservatives believe. How do you see personal responsibility playing a role in this healthcare issue?
I think it is a key issue, but the question is the system set up for it? We don't have a patient-centered system today. You can be as responsible as you want.
Who's it centered on?
It's centered on government and on employers.
What about doctors?
Insurers don't work for you. In fact, they get in the way of your relationship with your doctor. So what we need to do is move toward a system where patients are at the center. They're making decisions about their own health care. They're controlling the flow of dollars so they can choose their health plan, take it with them from job to job. And in that sort of setting, you'll see that payers, insurers, will work very collaboratively with providers such as doctors, and patients will have the ability to act on information. They'll have the incentive to be responsible. Today, there's no incentive to be responsible, and they can't act on the information that they do have.
You agree?
To a certain extent, if you had a product out there that was affordable for these individuals to basically express that choice, you don't have it. And I think it's the person on the blog said, health information technology is important, but hey, what about just the basic availability of coverage? And that's what we're trying to handle at the present time. Health information technology, we started the discussion that it's an integral part. As far as responsibility for the individual takes for himself, no one can argue with that. And we want, and Dennis has already pointed it out, what we're trying to accomplish is a thing called a medical home, where health information technology is absolutely essential to track that health history of that individual so that the doctor can assist that patient with healthy habits, for instance, and change in certain behaviors. Actually, information technology is probably the only way we're going to do it. The other thing about what constitutes quality health care, well, we would like to reward doctors on outcomes and performance. How do you keep track of that so that we don't have unnecessary treatments? Those will establish best practices. Again, how do we gather that information?